So now that you know a little bit about how these medications work, let's get back to our original question, which is, why in the world would someone refuse medication or treatment for that matter? Well, certainly the negative effects may outweigh the benefits of the medication, and that is an individual decision. You have to weigh the benefits against the real negative effects. The problem has been that pharmaceutical companies have not always been honest about what those negative effects are, so it's hard to make an informed choice. There are significant negative effects of taking neuroleptic medications, antipsychotic medications, and in a lot of cases, antidepressant medications. So let's talk first about some of the medication-induced movement disorders. So the first of which is dystonia, which is really the hallmark of tardive dyskinesia, and again is interrupting the brain's communication with the skeletal muscles. So there's all kinds of involuntary muscle movements, tics, things that motor tics, things that look a lot like Parkinson's. Those kinds of involuntary movements of the trunk. Someone may rock side to side or have their chin or their jaw moving around. They may have eye blinks. These are the kinds of things that we're discussing in terms of tardive dyskinesia. So the symptom is called dystonia. There's different reasons for dystonia. In our case, we're talking about medication-induced dystonia. The next medication-induced movement disorder is something known as akathisia. And this one is if you've ever had restless leg syndrome, it's like restless leg syndrome on steroids. It is this extreme sense of restlessness. So people pace, they seem agitated, they rock, they cannot stop moving. So this is an extreme kind of restlessness. And what's interesting is oftentimes people are restless, so they are given a PRN, which makes this even worse because this is a symptom of over-medication to begin with. The next medication-induced movement disorder is something known as postural tremor, and if you've ever seen Michael J. Fox on television, it looks a lot like Parkinson's disease, and I showed you a video of the classic pill roll. So a resting tremor. There may be tremors of the trunk or of the limbs as well. So these are symptoms, again, of brain damage from the medication, and these may or may not go away if the medication is stopped. The last negative effect that I want to talk about is the neuroleptic malignant syndrome that we discussed in the previous video. And this is not so much a movement disorder, but signs that the medication is interrupting the brain's ability to regulate the autonomic nervous system. So things like fever, high blood pressure, white cell count, all these kinds of things are significant negative effects of neuroleptic medication and can cause unconsciousness and death. Serious stuff. From very early on, when Prozac was developed in the early 80s, late 80s, we were told by the pharmaceutical companies, by psychiatrists, by practitioners that antidepressants were really, really safe. However, many people who were taking antidepressants found significant effects, particularly if they missed a dose. Things like described as brain zaps. So these little electrical, like being shocked inside your head, all these kinds of things. So they would go back to their practitioner and say, you know, when I miss a dose, I get these weird brain zaps through my head. And often what they were greeted with in response was, you know, we've never heard of such a thing. That's all in your head. Well, interesting enough, it was all in their head, and it was real. So with the publication of the DSM-5, we see the first time that the establishment, the American Psychiatric Association, the American Psychological Association, actually admit that there is such a thing as discontinuation syndrome. And here's what they say. Symptoms generally begin within 2 to 4 days and typically include specific sensory, somatic, and cognitive emotional manifestations. Frequently reported sensory and somatic symptoms include flashes of light, electric shock sensations, nausea, and hypersensitivity to noises or light. So if you're like me and every once in a while you forget your medication, then you're going to be experiencing some of these negative effects, and some of them are pretty unpleasant. One of the most significant negative effects of psych meds is really difficult to sort of explain to people. And that is the sense that when I'm on this medication, I'm not myself, that somehow I've lost what makes me me, or I've lost my sense of self. Other people describe this loss of self as almost wearing a mask, like there's something that's between me and the world, and I'm no longer myself, and I feel like there's a mask there. Related to this is this profound sense of apathy, or in today's terms, we might call it meh. This profound sense of not getting real excited about anything, not getting just meh all the time. I don't know about all of you, but another significant negative effect is weight gain. I don't know about you, but I don't want to gain another 30 pounds because I'm on a medication of one kind or another. The vast majority of medications do cause weight gain, and there are a few that cause weight loss. However, weight gain is a significant negative effect. Now, tinnitus, or ringing in the ears, may sound like a relatively innocuous symptom, but if you're trying to sleep and have it be quiet, or you're trying to concentrate, this can be a significant negative symptom and may cause someone to not take it. Tinnitus is, again, another common negative effect of medication. Another negative effect is usually described with the following euphemism: sexual dysfunction, quote unquote. But what does that mean really? And until you talk to people who've been on some of these medications, you aren't really going to get the straight story, because oftentimes doctors are really uncomfortable, psychiatrists are really uncomfortable talking about sex with their patients, and they really want people to take their medication. So they tend to downplay the sexual dysfunction effects of these medications. So we're going to talk turkey. We're going to be very explicit now about sexual dysfunction that can result from medication. So here's an example or a picture of the drug insert or the patient insert that comes with Paxil in this case. This is pretty standard fare. So this is the incidence of sexual adverse events, how's that for a euphemism, in controlled clinical trials. So for males, we have decreased libido, ejaculatory disturbance, impotence, and for females, we also have decreased libido and orgasmic disturbance. What does that mean, really? So again, as we talk about this lovely thing, sexual adverse events, which tends to downplay it, in the fine print, you'll see paroxetine treatment has been associated with several cases of priapism. So for those of you who don't know what priapism is, here's a graphic for you. It means that a guy will have an erection for an extended period of time, and it tends to be very painful and it won't go away, not to mention embarrassing. So it seems to me priapism is a significant negative effect of a psychiatric med, and would certainly make me want to go off a medication if I was experiencing that particular effect. Lastly, in the fine print, you see some things here that, again, are downplayed. This lovely little term right here called anorgasmia. What does that mean? What that little term anorgasmia means is that you will have, as if you experience this effect of the medication, you will either give up orgasms altogether or have difficulty reaching orgasm. So it could be tremendously either frustrating, or you may end up having to give up orgasms altogether. So this poor guy is still horrified thinking about the whole priapism thing. But some other negative effects that are significant are things like nausea and dry mouth. So in addition to that, these medications can affect your sense of taste. So all of these things are significant negative effects and reason enough for people to refuse those medications.